patient, mostly we discuss that what is the operative steps in this patient. On examination of the nose is entirely deviated on the right side and the C-shape deviation, tip also deviated, and dorsal aesthetic line also asymmetrical, nose entirely asymmetrical, ill-defined dorsal aesthetic line, over wide bony base, and the tip also deviated on the right side. You can better evaluate, look that in the cephalic view. In the cephalic view, you can better assess the deviations. And the patient also appear the depression on the right side of the ala area. And in the profile view, look that the patient have a little bit bump on this K area, and it appear the excessive columella show also. And on this basal view, look that this part of the caudal part is deviated, so left side of the nostril is blocked, and the nose appear the under projected. So the operative step in this patient, first you should have the complete expose the nose after the proper infiltration, and then after the exposure in such type of the patient, the key step that is the septum modification. So first you complete deglobing the mucoperichondrium from the septum, and if one side is the concave and other is the convex, then you first complete deglobing your mucoperichondrium on the concave side. So at least you preserve your mucoperichondrium on one side, and then you lift up your mucoperichondrium on convex side. And if you have a like buckling or the twisting of the septum, if you have a fracture, then first you remove the fractured part of the septum, and then once you complete expose, then you again evaluate the septum. If you have a axis part of the dorsal septum or the caudal part of the septum, then you first trim axis part, and then you do the septoplasty. And after the complete septoplasty, then you create the L strut, and then you just reposition the caudal part of the septum with the anterior nasal spine exact with the 4 of PDS suture properly fixed in the midline, and then after the osteotomy, because look that in this patient the key role of the osteotomy is also. So this side is the concave side, this side is the convex side. So first you do the osteotomy on this side. Why? Because first you free this lateral nasal wall, then this nasal wall after the osteotomy mobilize. Otherwise, if you do the osteotomy on this side, then it's very difficult to mobilize this convex, because this concave bone resist to mobilize this bone. So in such type of the patient, the sequence of the osteotomy is important. On concave side, first you do the osteotomy, and then convex side later. And if you use like maybe this patient need the intermediate osteotomy on the left side, so first you use the intermediate osteotomy rather than the paramedian and lateral osteotomy, because if we use first the lateral osteotomy, then it's very difficult to do the intermediate osteotomy in destabilized bony segment. So these are the two important things: sequence of the osteotomy, and which osteotomy first you use, and side also, either right side, either the concave side and convex side. So the key role in this correction of this patient, septum modifications and then osteotomy. So after the osteotomy, when you correct the dorsal part of the septum, then if you have an adequate amount of the cartilage, then you can use bilateral straddle graft, or if you not have the adequate amount of the cartilage, then at least one side you use on concave side big piece of the spreader graft, big piece of the cartilage, and before to using the spreader graft, you make the multiple scoring on concave side, and then graft use splinting on another side. This is the way. But if you have a adequate amount of the cartilage, then you can use the bilateral spreader graft. And if you feel that your patient have a little bit still the bending, then you can use the clocking sutures, septum rotation suture on the mid wall for proper straightening. And then in the last, because look that for correction of this part, you have this excessive columella. So you can use the modified tongue in groove. Because the modified tongue in groove, you can correct this axis columella by the septal extension graft, and on the septal extension graft, you just do advancement of your both of the medial crest. And the rest of the step are the same, then tip sutures, and then you close by the 6 or by 12 rapids. Thank you.